First, some welcome news for child care facilities and parents. The Maine CDC and DHHS are expanding pooled COVID-19 testing, both for adults and young kids. Child care facilities can now access pooled testing for children and staff. DHHS identified about 40 child care providers in underserved areas that are eligible. Both kids and staff can use these tests. Staff can use the tests if they're experiencing mild symptoms, and fully vaccinated staff who have been identified as a close contact of someone who tests positive can use them as well. If those people test negative, they can keep working.
Because we really do want to make sure we are giving our child care providers similar tools as we've been supporting schools with to keep kids safe.
Also part of the announcement, Walgreens is expanding PCR testing to nearly all of its locations in Maine as part of a different federal program. This week, 16 pharmacies began offering PCR testing in addition to rapid testing, joining 19 locations that already provided both free testing options. 28 more sites will add PCR testing by mid-October, and it's all free. Second, some encouraging news. The number of people hospitalized with the virus is trending downward. There are 166 people in Maine hospitals right now with the virus. That's down from 225 a week ago. 51 people are in the ICU now. 2 weeks ago, it was a record high, 88 people. And we got this question from Lynn in Brunswick. She wants to know how to maximize your immunity against COVID-19. She asks a two-part question, so let's start with the first. Does having recovered from COVID and having the vaccine give you more immunity? Here's what Dr. Shah had to say.
That's why the CDC recommends that even those who had COVID do go ahead and get vaccinated. There are some early data to suggest that the combination of pre-existing immunity from having had COVID plus the vaccine really turbocharges the body's immune system.
All right, here's part two. If someone who is vaccinated catches COVID, when is the best time for them to get a booster?
And the answer there remains, in general, when they become eligible for the booster. Right now, that recommendation is for folks to get their booster shot 6 months after they got their second shot. Either right now, it's just Pfizer, but that may change in the near future. With one important caveat, which is if you are actively recovering from COVID, if you're within that 10 days of your 6-month shot, you shouldn't be going outside anywhere. You should be at home in isolation so you don't get other people sick.